I'm not going to make the case that we in Canada need a national disease-agnostic, patient-led organization. After all, Ireland has one, Spain has one, Australia has one, the EU has one, and even mighty Bulgaria has one. Instead, I'll explain how it gets done. The most talked about issue and biggest shared challenge for all stakeholders in the patient involvement landscape is health equity. In a recent special issue of Healthcare Policy, examining public engagement in Canadian health policy, the inclusion gaps of marginalized groups will always beg the question whether the public engagement process is legitimate. Even CDA's own report highlights that, quote, input collected by patient associations with limited time and resources often does not explicitly include the voices of Black people, Indigenous people, or other people of color, people living with low income and poverty, those living in rural and remote communities, adolescents and young adults, or members of the LGBTQ community. Involve Canada is a member-supported national platform to promote the involvement of patients and families in shaping health policy. It is an independent, non-aligned, disease-agnostic patient partner organization uniquely led by patients. Let's take a quick look at the patient involvement landscape. There are two specific streams of involvement. On the left side is the advocacy community, composed of charities and nonprofits, generally representing a disease-specific population. There are over 1,000 groups for physical diseases, and this does not include mental health and addiction. They employ about 7,400 full-time and 6,600 part-time employees, with funding coming from donations, grants, and earned income. Measurement is based on the group's own goals, for instance, the number of patients supported or the number of programs delivered. And there is one national voice which represents just 27 groups out of the 1,000 plus. On the right side is the advisory community, composed of patient and family advisory committees and similar constructs in hospitals, academia, research, policy, long-term care, quality improvement, mental health, community care, etc. There are over 1,400 hospitals, 1,300 long-term care. There's the SPORE program, jurisdictional communities such as BC's Patient Voices Network, and hundreds of public and private advisory boards. A rough consensus would add up to over 100,000 committed individuals. However, funding and measurement are institutionally dependent, and there is no national voice. To address this challenge, Involve Canada will focus on equity solutions for the 3 R's of involvement, as no single organization or institution in Canada currently has the capacity or capability or mission to solve the problem. It will create a national patient pool to support involvement activities across the country and develop standards for involvement across the life cycle of medicine development. Importantly, it will facilitate a national community of practice for engagement professionals and represent Canada in international forums. Among the policy issues it will undertake is a patient bill of rights. Sweden has one. Why do air travelers have one and get compensated for a flight delay while patients are left to die waiting in the ER? And compensation equity. Why are patient partners on disability support having their honoraria clawed back by provincial programs? The governance model represents the next stage of community activation, moving from the current model of nothing for us, without us, to one that is done by us, for us. This raises the concept of a patient partner from that of an individual to one of an organization. Involve Canada is a social enterprise, not a charity, and does not accept donations. It is an inclusive community across the continuum of patient engagement and involvement activities across the country. This includes the Pan-Canadian health organizations, industry members, professional associations, academic and healthcare delivery institutions, and of course, patients, however they present themselves, whether as groups or as individuals. It is supported through membership fees and the provision of specific value-based services. The member community has various segments, and fees will recognize each segment's particular strengths and weaknesses in order to maximize inclusion. Membership for patients is free. Here are some examples of member-based healthcare-oriented organizations. You may ask, how can this broad membership base be patient-led and still maintain its financial and mission independence? Doesn't it have to be a charity? Well, there is another option that offers greater independence of operation, less regulatory constraint, more room for innovation, and a more democratic and inclusive structure. A cooperative is controlled by its members, which in this case would exclusively be patient members. Each patient member has one vote, unlike corporate models where a single shareholder can control many votes. The board of directors is elected by the members from candidates nominated within the membership, and management reports to the board. There are other member classes for the other community members, like the Pan-Canadian health organizations, professional associations, industry, and institutions, but they would not have voting rights. Control is retained exclusively by patient members. However, each individual community sector has its own advisory committee, providing feedback and advice to the board. And each community sector nominates two of its members to the board's strategic advisory committee in order to ensure that all members' voices are heard and have input to the strategic direction of the organization. Do you recognize any of these cooperative brands? I can't say it any better than Cormac Russell. When people create things themselves, they own them in a way that you can never, ever own that which has been created for you. Get involved today. Membership is free for all patients and patient groups. Go to involvecanada.com or join now with the QR code. Involve Canada launches April 1st, 2025. Are you in?